occupational therapy, which is a health and rehabilitation discipline that helps people engage in all their daily activities in spite of their disability or in spite of their environmental barriers. So we work in all different practice areas across the age span, and we have some opportunities here for you to try out some adaptations.
And then I'm working with physical therapy. These two guys and the guy back there, we're all from physical therapy. We've got some stations set up. Over here has got some balance over here. Those bands on that table over there. Got some strengthening that we can do. And the guy in the back, we have some grip strength and some tests and measures that we can do. So we just ask that you guys just split up, half to OT, half to PT, and then kind of just divvy yourselves up to each station. A little bit about physical therapy. We work on movement and strengthening and getting you guys back on your feet after an injury. So we can explain more as feel free to ask any questions. We'll explain more at our stations. Okay? So go ahead and split up.
Go to physical therapy?
Yeah. Take this up, guys. Over here?
Yeah.
Hello, how are you?
Yeah, get one or two people here. Okay, cool. So you got therapy. Okay. So how do you hear
You guys have PT right now? You guys have PT class? You guys ever do exercises like squats or something like that?
We do a little
So
So do you guys know what a squat is?
practice, right? Kind of help you work them back to where they got before they So we got some cool so let's say someone is having balance issues, right? So see if you guys got some good balance. Stand on one leg right now. Up the other way.
I want you to try to
Stand up, good. What about one leg with eyes? Oh, we got some people falling, sweating a little bit.
kind of hard.
Right? Okay, so let's say, you guys obviously have pretty good balance. Someone didn't have good balance.
Harder you can. I'm not that strong, but you'll probably be stronger than me. And I got 52 pounds of strength. From there, we write that down, and just like our other measurement tool, we want to get stronger over time to show that we're getting better.
And now it's heavy.
Let's see, we're going to test both of you guys. You ready? So you're just going to put your elbow by your side and squeeze as hard as you can. All right?
How about you?
All right. Yep, stronger than you, just like I expected. So you got about 28 pounds of strength, which is good. Packing some power. Want to try it?
You hurt yourself already.
Squeeze as hard as you can. Up, and you got about 27. So you're almost as strong as him.
That it is necessary that there should be equal access to good health care, to screening for our minority communities, same as would be in majority communities. And so that's why we find that sometimes the societies are not necessarily set up to help. We have to do things for ourselves and to help ourselves and our communities. And so it's good to see you guys out today to see, and this is a mentorship day, so that you have awareness of different specialties in healthcare that are possible. So you don't have to be a doctor to help the community. You don't have to be a nurse only. I mean, there are lots of other fields in healthcare, physician associate, physician assistants, there's nurse practitioners, we have radiation technologists, surgical techs. There are lots of things that can be done in healthcare. And so the one thing that we want to portray to you as upcoming adults is that you can't just go for the low-hanging fruit. Most people think if you come from a minority community, you want to play football, basketball, and make it rich, become a millionaire, and then you have the big cars, the big house, and that types of things. And not everybody is going to be able to make it in sports, or in Hollywood, which is the other where people think that they can get there fast and make it easy. So we believe in what's called delayed gratification. You work hard, you study hard, you do your homework, you listen to your parents, you follow the directions. I know at this age it's kind of tough because you think you know more than they do because you can text faster and you have your smartphone. But your parents have been through it, they have the experience. They know what worked and what didn't work, and they try to help us with that.
When I graduated, then I owed them 3 years, and they commissioned me as a first lieutenant. So for me, it worked out. And military nursing is a very good career because the Army Nurse Corps then, years later, sent me for my master's degree. And the GI Bill, I worked on my doctorate, so it's a very good career.
Yeah, I was planning on doing that too, working for the Army so that they could pay for my medical school. But I was wondering, where were you stationed? Where did you work for most of your career?
I have worked all over the world. I spent 3 years in Frankfurt, Germany. I've been in Maryland, I've been in North Carolina, I spent a lot of years in Texas because that's a training center and I got into education. I ran the trauma center at Brooke Army Medical Center, which is essentially the largest medical center, one of the largest in the Army. I didn't go to Vietnam and I didn't go to war because I ran the trauma centers where I was, and when they broke, I don't know if y'all are too young to remember the Iraq War, which I call Daddy Bush's war. Before George Bush, but Daddy Bush. We had Iraq War. They wouldn't let me go because I ran the trauma center. I had 4 buses, 32 ambulances, and all the clinics and the emergency department. They were turning the hospital into a gigantic 1,000-bed burn unit because they were expecting all this chemical warfare. So they took my entire staff and shipped them off to Iraq and brought reserve nurses from Illinois and Wisconsin down for me to keep my emergency department running and made me prepare for all the casualties, which fortunately never happened. But I've worked all over, but 3 years in Germany was a wonderful tour. I was a consultant for nursing education for the military, so I traveled to all 11 military hospitals at that time. We had 11, and I got to see everything. Matter of fact, after 3 years, I wanted to stay longer, and they wouldn't let me. They made me come back and go to recruiting.
And this is not melbatose, but this is actually a cross-section of lung.
Our lung.
Yeah, Brian's lung. We took it out this morning.
And then we have our lovely smoker lung. So if anybody's smoking, which you shouldn't be, look at the difference between your lovely pink lung and...
This one has a nice tumor in it, too.
Oh.
Hey, blow it up.
Yeah.
Oh, dope.
You know? Baby. It's a possibility. I don't like when it's dripping.
Yeah, when we go through to high schools and stuff, we do this to say, this is why you should not smoke.
See all them parts that ain't inflating. Parts that lock, close.
Just one glove. That's all you need. Because we have to get through the entire day, too.
Okay.
But what we're going to do is just gently, because this is a real lung, if you come up and grab it, it'll tear up. And also, if someone wants to operate this, we'll have you go through, because this is what we call a TheraVest. What it does is with patients with certain diseases like cystic fibrosis, they have to get secretions out of their lungs. We wrap this around them, turn it on, and vibrate them.
Try this.
No, we're going to wrap it around just, so give me 1 second. I'm not, all right,
And this is mainly like if you got anything, any secretion stuck in your chest, it's gonna shake
yeah.
loose.
So a lot of people with fibrosis will do this, and then what they end up doing, look at how much it is. It's going to start, and then it's going to work its way up.
Kind of, but what it's doing is oscillation. It's doing mini coughs behind the, like if you had secretions, it's helping moving them forward so that you can get them out. So patients with cystic fibrosis have very thick secretions.
Yeah. And then they'll make it to where it's keep the breath in.
All right.
Oh, bro, you'll be a nurse.
I usually do this.
Okay, so we're all from St. Mary's Medical Center and the Palm Beach Children's Hospital. Tell me what you would like to do.
cooking and animation.
Ooh.
What kind of cooking do you do? None yet?
You're interested in cooking.
Okay. You guys hiding your head back there.
Me?
Yes.
My name is Halden Hill from Douglas Middle School.
And what would you like to be when you grow up?
An engineer.
Wonderful. Wonderful. An engineer too?
I know she's pregnant.
I wanted to be animated.
Marisol, you want to tell us?
Sure. My name is Marisol Pelham. I am the nurse manager for the pediatric emergency department at Palm Beach Children's Hospital. I love what I do. Kids, I just love working with kids and helping them. That's what we do. I became a nurse probably 12 years ago. I was older. This was my second career. And just didn't know if I wanted to do it because it was too hard. The sciences were going to be too hard. I didn't know if I could study, all the things that you think about, when you're going to school. I realized that no matter how old you are, you can, achieve your goal. So I went back to school, and here I am.
So my name is Stephanie Lang. I work for Marisol. I'm an assistant nurse manager in the pediatric emergency room. I've been a nurse for a little over 10 years. I also went to school a little later. Went to Florida Atlantic University, have a bachelor's and master's degree from there. And I too am a testament. You don't always know what you want to be, and sometimes your path takes you in a different direction and you're inspired by different reasons, but I really enjoy working with children and helping them and trying to keep them well and safe. And I think that all of you, so most of you probably like math. You all are engineering, interested in engineering, so you're mathematical, so that's awesome. That was probably the hardest thing that I ever did, was take college algebra. I cried many a night. I needed probably your teacher to inspire me, prod me. But no matter what it is, you can overcome it. Get your goals and get your dreams.
Not to sound like a broken record, my name is Dee Dee. I too went back to school later. I was actually inspired by my mother-in-law. I was taking care of her when she got sick with breast cancer. And we had hospice come in. Hospice is an organization that deals with end of life. They do what's called palliative care, which means they help you to feel better, not have pain, and die a peaceful death. Everybody's going to face it one way or the other. So I was inspired by her to go back to school, and I started in trauma and orthopedics at St. Mary's. And I love my manager so much, I never left. So I've been doing this for about 12 years, orthopedics and trauma. We get to put people back together and get them back out into their lives. So very rewarding.
Yeah, good.
Edwina.
Yes, baby.
What do you do when somebody's choking?
You trying to get the object out.
You perform the Heimlich maneuver, correct.
How do you do that?
You put your hands on like their abdomen or something, and then you like give thrusts.
Yeah, get abdominal thrust. Great.
Right, you put your hand around their body, above the navel, below the sternum, and you would do inward, upward thrust until the object comes or until EMS comes to take over. And the Heimlich maneuver on a baby. The baby's choking, you would do 5 back straps in between their shoulder blades, and then turn them around and do 5 chest compressions. And you will continue to do that until the object comes on or until EMS comes to take over as well. So, I mean, you guys can try it on your mannequins.
Tap out. You want to tap out. Tap out. Tap
One,
ginger tea.
You know the leaves outside?
No. Really?
Every
Well, I get used to it because they have different academies at this school. They have the medical EXE reproduction. They always have classes.
You get to cover the
and we can't say we don't want to be in it because once we sign up for the school, it's in the handbook. So.
You don't read it. He's like, why the chairman's over here and I didn't sign for nothing, but you really did.
Wait, yeah.
I'm barely.
So what's that?
So do you guys like understand how like a EKG machine works?
Okay. You gotta have any questions,
Are you guys like interested in medical program?
She's shaking her head. Yeah, like she's the only one.
What's your interest in?
Honestly, like I used to when I first like came here, my mom she forced me into like the medical program. I was like, I don't want to come to school. I have to wear scrubs. I don't want to do this. I don't want to do that.
We have to be in these every.
You have to be in this every single day.
White shoes.
I thought y'all got like
That's if you
jacket.
Yeah, so like I didn't want to be in the medical program. So basically, you learn a lot about yourself. It's not just how to to care for other people. You learn about yourself as well, and it's easier for you to take care of your health because you know the factors that go into your health. So it's easier for you.
You grow into it.
Yeah, you grow into it.
Yeah,
You're not gonna love it the first day.
My freshman year here, I literally I thought I wanted to be in the medical, and then I had this phase where I was like, I don't want to do this. It's too much work.
We all felt that way.
But then when you get into upperclassmen and then you start actually doing hands-on stuff where you start practicing on people, it gets fun after a while.
Yeah.
So it's like now whenever I hear about the heart or injecting somebody, I get excited. It's very exciting now.
Yeah, it's very
But
interesting.
she's not.
I never used to like it. No, eventually I will.
Well, y'all talking about him.
I'm
What
gonna
you guys do
discuss
on
about it.
clinical?
Usually LPN does it. Usually LPN
I could explain that.
So they get to watch like clinical or LPN.
Oh yeah, and we get to go a lot of places.
Yeah, we get to go we get a lot of perks too.
For instance, if you decide to join the LPN program here, I did it my first year, my first semester and first year for LPN. What you'll pretty much be doing is like CNA towards the beginning course. So you would be going to a nursing home, shadowing a CNA, and pretty much you'll be learning how to do a bed bath, rotate the patient, walk with the patient, take a patient to the bathroom, the whole 9 yards. And this is pretty much between like a 2-hour period, so you'll be at that nursing home for like 3 hours.
That's what
And come like towards the middle of lunchtime.
How about like when you graduate, your certificates, how you can get a job?
When you graduate
We'll get started then. My name is Derek. I'm a third-year medical student, and then I'm currently a third-year medical student at LECOM, which is over in the Northwest Sarasota area. I'm currently pursuing orthopedic surgery and a fellowship in trauma surgery.
Isn't it bone?
Yes, but bone, joints, like ligaments, sprains, all that kind of stuff.
That's cool.
I'm Justin. I'm from Fort Myers, Florida. I went to a small school in Pennsylvania called Dickinson College where I graduated in 2013. I'm also a third year at LECOM with Derek. We're both over here at Wellington for a year doing our third year rotations. Also pursuing a career in orthopedic surgery, but with a fellowship in sports medicine. So like torn ACLs, rotator cuff injuries, stuff you see the sports athletes get, things like that.
So let's say a little bit about the hospital. We were at Wellington Regional Medical Center, which is about 15-20 minutes south of here. Okay, what does your mom do? Awesome. Do you know what floor? You know what floor she works on? No. So it's a 233 bed community hospital right down the road. It was opened in 1986, and it's the preferred choice of hospital for the equestrian community. I know a lot of y'all probably know like the Wellington area is huge for horses and all that kind of stuff with everyone coming down from all over the world. We have an internal medicine residency program there. It's the only residency program there, and there's 6 spots per year for internal medicine. And then the Wellington Regional Medical Center is the operating room for the Bone and Joint Center for surgery. which is who we rotate with. Dr. Sama is the orthopedic surgeon that we go to.
So, yeah, I guess we won't do that. So, schooling requirements, so a lot of people say 4 years of undergrad with a degree. Most people get a degree, like a bachelor's of science. But you can get your degree in anything you want. We have people in our grade who are philosophy majors or stuff like that. As long as you go to the medical school's website that you want to go to, see what their prerequisites are, and take those, and take the MCAT, which is the medical college admission test, you can get in. It's just most people are interested in the sciences, so that's what they major in. But there are a bunch of people that don't have science majors as well. And then once you get in medical school, whether you go MD or DO, we are DOs, it's just a same degree, same scope of practice, but different way of looking at things is the easiest way to put it. First 2 years are your preclinical years. You spend them in the classroom, learning the anatomy, the biology, and all stuff like that. And then your third and fourth year, which are, we're in our third year now, so you're out in the hospital, doing rotations of different specialties. They make you do certain ones in all different areas of the field just as a way to kind of figure out what you want to do. Because you'll do that one rotation and it'll click. You'll be like, this is what I want to do. This is cool.
I have a question. Yes. Is there a way through speech training that we can get, or I can get my students to lose the, I forgot my homework, nerve? That was due today, or the, huh? How can we eradicate those avenues that the children love to give to me? And especially when I'm off on a Friday and they have work to do, and then they email it to me thinking that they're sliding it in on time.
Well, let me let you talk to the students so that you can get a feel for it. But anybody who says huh can hear.
Hello, isn't that what I tell you?
Number
If you
one.
can, you can hear.
Number two, the excuses are in a book, and that's where I place them. And I have a solution for all your problems.
Every time I say I don't know in her class, she says, well, you better figure it out. And I gotta look it up and answer that question right there.
I'm gonna use that.
Yeah.
Come on, Brand.
And he's still.
That he's still negotiating?
Yeah.
That's nice.
This is my subtract student. He adds and he subtracts. Okay, turn around. Stay focused.
Miss Graham wants to talk to you.
I'm Jennifer, and I'm a master's student at Nova Southeastern University for speech and language pathology. I figured out I wanted to be a speech language pathologist around when I was in high school. I was babysitting, just doing, basic things for extra cash, and I really liked just hanging out with kids and doing little kid stuff. And when I talked to my mother, who was a teacher, I was like, Mom, maybe I should be a teacher like you. And she was like, no, don't be a teacher. Do something that'll get you some more money. And so her best friend is a speech and language pathologist. So I talked to her, and she was like, why don't you come and sit on one of my sessions and see what you think? Maybe you'll like it. And she's like, you could do speech therapy, occupational therapy, physical therapy, you could do anything. She just happened to be a speech therapist, so I went along with her to see what her sessions were like, and I ended up really liking it right away. So I majored in it when I went to college, and now as a master's student. And speech language pathology, there's two parts of it, speech and the language. And I initially, of course, when I started, I was like, oh, they're the same thing. But they're totally not. And what I have noticed that I really like particularly is the language aspect of it. Right now I'm working with kids with autism, and for them, they can't even formulate to me how to say, like, Miss Jen, I have to go to the bathroom, or I'm thirsty, or I don't want to play with those blocks. Like, they can't even communicate with me just to tell me something basic like that. So I think it's very interesting that we as speech language pathologists kind of start from the bottom and we do the basics, just people talking to each other. And then once people can talk and communicate, then they can go and do whatever they want to do. So it really starts with us, I think. And also, I think it's cool because me and Aunt Julia, we're getting the same degree as speech language pathologist, but she's right now working in a voice lab where they put scopes down people's throat and they look at their vocal cords. But I'm kind of doing something totally different, and I'm interested in disabilities. You can do whatever you want with it.
All right. Thank you.
Going back to you guys' schoolwork and turning that in, you all want to be in the medical profession, so you have to know that you have to be ready at any time, ready to
know the information. If the teacher asks you, you need to be able to say it back to them and be confident in your answer. Even when it comes down to whenever you do become that professional and a client comes to you and maybe you're not sure how you can help them, you're not just going to say, I don't know to them. You're going to figure out how, if you can't help them, how somebody else can help them. So when it comes to, you should take that now, like when you're in school. If you don't know how to do your homework assignment or you're having it a little bit hard, figure out how you can learn how to do it correctly. Don't just stick in the mind frame of, I don't know how to do it or I can't do it, because you can't. There's always a solution. There's always a solution out there. And like Jen was saying, the profession is so cool because you get to work with a lot of different professionals that are focusing in different areas of speech language pathology, or physicians, OTs. I have the chance to look at people's throats, the inside of their throats, and look at their vocal folds moving, looking at what's going on in their nose, their soft palate, how what you hear matches what you see on the screen. So in school, when you're looking at it in a book, it's so much different than when you actually see that person right beside you and you see what they're going through on the screen. And it's a lot to take in, and you feel proud and happy that you got this far to be able to be sitting here close enough to learn how to one day be that profession that you're working under. So I think you have to take every experience, the schooling that you guys are doing now, just take it in as much as you can. Find somebody that you can talk to about what you want to do. Maybe you're not sure, maybe they can help you kind of narrow it down. And that's my advice to you guys.
Any questions?
You want to, it comes from moles, or it could look like a mole, and it could be black or brown, and on light colored people, it's pink or red. And ways to prevent this type of cancer will be staying away from the sun from the hours of 10 a.m. to 4 p.m., wearing sunscreen, SPF 30, and also you could, and avoid tanning beds, and that's it.
So right here is going to show like specific colors on your skin. Like for whites to blues, normal. White spots is dead cells. Purple is lacking moisture. Light violet is dehydrated, and yellow and sometimes pink is oily skin areas. So right here, you're gonna put your face into the mirror, and then me and you both is gonna see the areas on your skin. Just bring your face all the way to the mirror.
So tell me what color do you see on your skin? Like your nose, what color? Huh? Black? Okay, the area on your nose.
So this is the most important
They're right by 5 times.
Ideally, you don't want to. They're doing a great job.
Stop it. I am so proud of you. Yep. 3 fingers are going to be under your chest. Yeah, there you go. Now look on the side. Yeah, you can feel his pulses. You can like spread the back of his He like exhales. Let me show you. He inhales. Let me show you. Yeah. Come here. Do you see that? Is that what you were seeing earlier? Okay. So come here and see.
Stupid.
Bring that to the So I'm gonna hold my blade. You're gonna put the tube through
I know, it's too tight.
So to reverse it before you take it out, you want to make
That was a really good answer. So, what she said is what pharmacists do is when the doctor writes a prescription, you bring the prescription to the pharmacy. The pharmacist is the one who makes sure that you're having the right medication, the right dose, and that what the doctor gave you was the right thing before you put them in the bottles. Very good. How about back here? Oh, were you raising your hand? No. Anybody else? All right, so that jumps into our first question here. So I'm going to read them through and you guys tell me what you think is the best answer. So what describes what a pharmacist does? Do you think that pharmacists spend their days counting pills, putting labels on bottles, and collecting payments for medication? We call this dispensing. Do you think a pharmacist spends their day reviewing and interpreting physicians' orders, monitoring drug therapies, advising interventions, and counseling patients? That would be the second choice. Third choice, they spend their day discovering, developing, testing, and manufacturing new medications. So how many people say one? Okay. Okay. How many people say two? We got some twos. Okay. How many people say three? And we got some threes. So how many of you said two?
Me.
All right, the
Okay,
two
keep the hands up.
So,
2 hands up.
so with option 1 and option 3, it's kind of encompassed in option 2. And we have actually pharmacy technicians and people who are pharmaceutical scientists who do mostly 1 and 3. But so reviewing and interpreting physician's orders. So as someone pointed out already, what happens is the patient's going to see the physician first. And then when the patient sees the physician is going to try to figure out what's wrong with the patient.
Oh, I'm sorry.
So the physician's going to try to figure out what's wrong with the patient. And we call that diagnosing the patient. So after the physician tells us what's wrong with the patient, what do you do next? You got to figure out which medications to give them to help them with whatever is wrong with them. And so it's up to us as the pharmacists to help those physicians figure out what's the right medication to be on. And when they write those prescriptions, we're the ones looking at that prescription as the double checker and saying, that's the right medication, this is the right dose, and this is the right amount we're supposed to give. Monitoring drug therapy. So unfortunately, all medications have side effects. So it's up to us as the pharmacists to make sure that our patients don't get those side effects. Advising and interventions, so that's what I talked about before, but also with everybody on the healthcare team. So nurses, they need to administer or give the medications. The pharmacists sometimes have to teach the nurses of this is the right way you hang the IV. This is the right time you give the medication by mouth. We're the ones teaching everybody that. And then counseling patients. So imagine that you pick up a prescription today. You're probably going to ask yourself, how is this medication going to help me? What do I need to worry about with this medication? Does it interact with anything that I'm already taking? As a pharmacist, it's up to you to help counsel and teach the patient of all those questions to get those answers. So,
My mom is a nurse, and when I was growing up, I did not want to be like my mom at all. And I thought medicine was not for me. And then I started working in the operating rooms at a hospital in Boston, and I fell in love. It was the world I was meant to be in, and I just, my eyes were set on medicine from then on, so that's why I decided to go into medicine.
My question is, once you after your 2 months, what do you go beyond that point once you become
So I graduate in April, and then I have a little bit of a vacation, and I start further training in July. So I'll have my first real job, and I'll be getting paid. And I have 3 more years of training. So I'm going into internal medicine, and I'll be working at a hospital, taking care of adults in a hospital. And then after my 3 years of training, I can practice on my own. I don't need any more supervision.
A question for all of you guys. Tell me in order what do you guys want to be. Okay.
It's still up in the air for me kind of a little bit. I was thinking about going to obstetrician gynecology, but I want to be able to do some
countries with medicine and stuff, so that's what they do.
I want to be a pediatric and adult cardiac surgeon.
I want to be a pharmacist.
Oh, yes.
That's my favorite girl in the world.
I want to go for nursing, like I want to get my bachelor's degree in nursing, and then later on part-time pharmacy as well.
Just like Afuna, the first one, I'm also kind of up in the air, but me, it could be also being a kind of a trainer, but really it can be economics and marketing.
You know, I have an electrical engineering degree, so they require quite a bit of studying, quite a bit of math, and also a master's degree. And I work for a couple of companies, but right now I'm a medical device rep. So what I do, I'm in the operating room every day, and it's like your studies. You can't guess what math is. It's either right or wrong, correct? There's no, I was almost close. It's like with anatomy. As a doctor is in surgery, they can say, I think that's the heart, it might be the stomach, I'm not sure. But I can tell you, what is this right here? That's the stomach. My role is I sell medical devices in the operating room. So let's say the patient has stomach cancer or a diseased stomach. My device will basically cut out the bad cancer or the disease. So can I get a volunteer who wants to help me? Okay, what's your name? Shreya. Come on up. Let me have I just need a battery out of the other one. Sorry. Thank you. Okay, exactly. So you said, is it Soraya? Shreya. Okay, Shreya. So she's going to basically take the diseased part of my stomach out, and I'll show you what to do, okay? Let's go across the stomach. So I want you to use this handle and close, okay? You see a little red button there? I want you to pull it back, okay? And the gray button, I want you to hold it down. And let go. Now push this button forward. And, okay? And look what she did. Basically, she cut the disease out of the stomach. Great job. Thank you very much. Exactly. The patient's going to be healthy. So that's right.
She's going to be a future nurse.
Future nurse. Exactly. I work with nurses. I work with doctors. But my role is, again, is educating. I educate my surgeons. I educate the staff how to use the various devices I sell. You know, lung cancer, stomach cancer, what have you. So again, education is so important because if I'm talking to a surgeon, I talk clinically. I have to talk their language. Yes, question?
But when you cut the disease out, isn't it going to like spill blood or something?
Great question. Will it spill blood? So if you recall, I said at the beginning, this device staples and cuts simultaneously. So as it's cutting, it's laying staples down. So it basically brings the tissue together so there's no bleeding. Yes?
When you create these things, like, is it hard?
What's hard?
Like,
Selling?
creating.
Creating with the devices? That's a great question. Well, again, that's Johnson & Johnson. The question is it hard to create devices like this? It's extremely hard. But we have research. We have a research team, and again, academics, very, very smart people. They design these devices. Because think about it, when you put a foreign device on living tissue, we don't know what happens unless you do the research. So again, it goes back to respect for living tissue. And our researchers, our engineers, they do the research. And it requires a lot of studying, it's a lot of testing. So yes, it's very difficult, but again, when you have the right people in place, they get it done. That's pretty much my story.
That would be the number here. It's called an SpO2. It also takes your pulse. It takes a second to register.
You put the blood pressure cuff on?
No, we're just checking her SpO2. She's 96, and there's her heart rate. That's a good heart rate. Yeah, you always have to remember to put the. It doesn't work with like acrylic nails or nail polish, and you always have to remember to put the red part on the fingernail bed. You know what I mean? I think that might be our division chief. She's.
Is that her?
It's okay. We'll go over there. Let's see. So there you go. You're breathing 100%. Can't breathe better than that, and your heart rate's 83. That's good. What's a normal heart rate? 60 to 100.
show you some medicines. What you got? So when you were taking my heart rate, oh, that was mine. Oh, like breathing 99% and your heart rate's 109. You know, caffeine and energy drinks are no good for you. Soda, yeah, and plus it's hot. When it's hot, your heart rate goes up. I don't drink soda, I don't drink coffee. I don't drink water, but I drink all those energy drinks are terrible for your heart rate. Anika. Says 0, 0. There you go. 98%, there's your heart rate, 80. Oh my God. Perfect. Yeah, let me show you guys some drugs that I have. This is our narcotics drugs. This is Valium. It's people that are having seizures. And then this is morphine. We draw it up and give it to people that have like really bad fractures for pain and Versed. Which one was for seizures? Valium. Valium? Yep. Yes. And then we get a lot of diabetic.
Draw it up.
First we check their glucose. Did you guys learn how to do that? Check people's glucose? You'll probably learn how to do it. And that checks. Oh, okay, so you know, under 60 is no good. So under 60, we would start an IV and we would give them sugar. Dextrose. Sugar. If you can't get an IV and they really need sugar, we have something called glucagon. It's right here. We give it to them just right now on their adults. Or if they're awake and their sugar's dropping, this is just oral glucose. You should just have them swallow.
But the sugar has to be what, over 40
Kind
or
of like
something?
icing and cake, but not as delicious. And then we have all kinds of drugs for a low heart rate. Like if somebody's heart rate is 30 and they're really, you know, they need medicine to make their heart rate go up because that's not normal for them. This makes atropine, makes your heart rate go up. We have medicine that makes their heart rate go down, because it's also dangerous to have like a super high heart rate above 150. It's called SVT, supraventricular. You have to cardiovert the person and give them medicine because that's a deadly rhythm as well. And then I told you about the Narcan. You have mag sulfate for women that are pregnant. If you're pregnant and your blood pressure goes above 140 systolic, that's not good. You have a whole different blood pressure readings when you're pregnant. You need mag sulfate. And then we have Benadryl for severe allergic reactions. We have albuterol for people that are having they need a breathing treatment. We put this in a little vial and vaporize it. Half the dose for kids. Albuterol.
Oh no, I was thinking of the machine.
Oh, a nebulizer. Right? Let's see if that's we have medicine if somebody's nauseous. We have anti-nausea medicine. We have medicine for everything.
Okay, all right. So you're second to last one. All right. So welcome to the Medical Entrepreneurship Group. How many of you know Mr. Wiley in the class? All right. So Mr. Wiley took the top medical job and lifted all the median salaries. But what's unique about this particular group is they're entrepreneurs. So there is no salary cap. The harder and smarter you work, the more money you make. So I'm in sales, so I have a boss. The reason they lump me with the entrepreneurs is because as a sales rep, there is no salary cap. And I'm also in the healthcare field. What you'll find out from the entrepreneurs is that they also have to be sales reps because they're always selling their business. So without further ado, we're going to introduce to you our entrepreneurs. Let's give them a round of applause.
Go ahead. Alright, hi everybody. How old are you guys? Now, how old are you guys? High school, middle school?
I'm in ninth grade.
Middle school.
I'm in ninth grade.
Ninth grade, okay. So, who has an interest in healthcare? Okay, what do you guys want to do? Pediatrician, nice. I see. What do you want to do?
Physician.
Physician. Do you know what kind of physician you want to be? Not sure? It's okay.
I just want to be a doctor.
You don't know what kind of doctor?
That studies bones.
Doctor that studies bones.
Orthopedic surgeon.
Alright, so who doesn't want to be a doctor or anything in healthcare? Well, you guys don't know yet, because I saw a couple hands that weren't raised. So what do you want to do? You want to be a pediatrician? You on the fence? What are you on the fence with?
Law, holiday,
Okay. So cool. You could cook. All right, so I'm gonna come over late for food, okay? What do you want to do? Between law and medical. Okay, cool. All right, so I have a medical background. I have a double bachelor's in bio and healthcare administration, so I have a clinical and administrative background in healthcare. I have my own business. It's called Innovative Health. So what I do is I build healthcare apps for healthcare organizations, medical group practices, hospitals, so on and so forth. So you know how you guys have like your Apple, your iPhones, or your Androids. So like you know how you go to App Store and you download apps. So I create medical apps for different businesses. How about Fitbits? You guys heard of Fitbits? Or little fitness wearable things that people wear? So I create stuff like that. You know, I create those types of products. So I partner up with other companies that are abroad, whether it be in Europe or Asia, and I serve as a distributor for them here in the U.S. So that's a little bit about my background. How did I get into doing what I was doing? Pretty much what ended up happening was I was managing a multi-specialty clinic in Miami for a few years. So I oversaw a clinic that had internal med, family med, psychiatry, pediatrics, and we were training for medical students abroad from the Caribbean also. So, you know, through those experiences, what ended up happening was in healthcare, there was a transition. Everybody heard of Obamacare, right? You guys heard of Obamacare?
Yes, 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 yes.
Affordable healthcare? Affordable healthcare? No? Okay. But all that is so healthcare legislation happened. Doctors were panicking. They were transitioning from paper, doing things by paper, to electronic. So that's kind of how I started in the business that I was doing, and it just in a sense evolved. But that's kind of how I got into what I was doing. But I'm going to pass it on to Grant. So go ahead, Grant.
Thanks, Stefan. My name is Grant Johnson, and I'm a little different than the ones you guys have been hearing today because I don't deal with actual physical health. I deal with financial health. So some people might call me a banker, some people might call me an investment manager. But what I do is I make sure that people can plan for their futures, plan for their retirements, plan for kids' education, all of these things. So my background, the way I got into the business that I do now, and I work for a company called Merrill Lynch, which is part of Bank of America. I'm sure you guys have all heard of it. I basically really liked math, and I liked working with people when I was growing up. I wanted to figure out how can I combine those two. So I started exploring, I started joining different clubs, getting involved in things in high school, talking to people, trying to figure out how can I combine my math and wanting to work with people. And I kind of like money too, because I think that stock market thing is interesting. So, you know, people started, as I was asking them for help and guidance, they told me the career path that I could go on. And that career path was wealth management or financial advising.
Graduated. That's with the C in my CRDH stand for. I'm certified in delivering with anesthesia.
Why do you guys scrape the teeth?
Okay, we scrape the teeth to remove deposits. There's two types of deposits. There are soft deposits, that's plaque. That's when you take your fingernail, you ever got that white smudgy stuff off your teeth?
Yeah, and you scrape
That's
it.
plaque. Do you know what plaque is? Like really what it's made of? Butter? Okay, plaque is bacteria. Bacteria is a living organism that we can get anywhere. That's why when we get a cut, we put a Band-Aid on our scrape so we don't get bacteria in there and it doesn't get infected. The plaque that grows on our teeth, bacteria. When we floss and our gums bleed, it's because we left bacteria behind and it's caused an infection. That infection is called gingivitis. Have you guys heard of that before? That's what that is. As the hygienist and even as the assistant can sit down with a patient and teach them home care. we teach our patients how to adequately remove that, because we can floss but be doing it wrong until someone shows us the right way. So we remove the soft deposits as plaque, hard deposits, which that's really when they're scraping hard. They're removing, we call it calculus. You guys might know it as tartar. You have your tartar control toothpaste. It's hardened plaque. It's plaque that has sat there long enough to almost fossilize and turn in like to a rock. So when we scale that off, we can give it to our patient and say, hey, touch that, it feels like a rock. That means it's like a barnacle on a bone, really hard calcified plaque. So that's why we scrape, because some things can easily be polished off, some things we need to scrape off because it's so hard. Is there any questions over here? Another one?
You forgot. What is the little needles with the round into it?
The little needles with the round.
And
Like the Explorer?
Is it like an instrument? And then it has like a little.
that. Yeah.
Okay, this isn't quite it, but it's shaped the same way on a handle like this. It's called an Explorer, like Miss Lightsky said. An Explorer, because we use it to find things. Like when you go on an exploration, you're looking for something. Well, we use the instrument, we use that little hook to feel for decay. Decay is a cavity. Decay feels sticky. So as we go around the tooth and we explore, we get a stick. That enamel, the white part of our tooth, is breaking down. And that's what we use that for, to help us find that. I got a question over here.
Like, if we have cavities in our teeth, what does it do?
If we have cavities in our teeth, what does that do? What does that mean? Okay, so a cavity is decay. Decay means breaking down, right? So our nice hard enamel on the outside of our teeth, when we get a cavity, that bacteria, that plaque that was sitting on our teeth is starting to eat away. And the reason what's causing that eating away is the bacteria, that living organism. When we eat and we don't brush or we don't floss and we leave that food in there, the bacteria starts to eat that food. And when you eat food, what happens a few hours later? You gotta go to the bathroom, right? Because you put fuel into your body, now you need to get rid of it. Well, that's what that bacteria does. It eats that food, it goes to the bathroom in your mouth. It's called endotoxins. If you look up what's endotoxins, it's waste. Bacteria eats the food you eat, it goes to the bathroom, it creates acid. Acid breaks things down, it breaks down your enamel, and it causes that cavity. Did that answer your question?
Yeah.
Okay. Did you have a question? No? Yes.
Aren't there two, when they clean your teeth, aren't there two things that they use to clean the water and the beer?
Suction.
Yeah.
Mr. Thirsty, as when you go to the kids dentist, like to call the suction, it goes around to remove your saliva.
The toothpaste
That is
the
this.
same thing.
They put this on a handpiece. So kind of like it's a cylindrical, and then they put it in the prophy paste.
Tickles, so it's like gritty,
Yeah,
sandy
crunchy.
toothpaste.
That's what we use to polish. A dental hygienist and a dental assistant can polish teeth.
And then you take the little orange thing.
That's fluoride. So it's like a sticky paint that they put on your teeth and you can't eat or drink for half an hour. That's called a fluoride varnish. So it stays on your teeth and that helps prevent, it's like vitamins for your teeth and it helps prevent decay. That's the best thing you can do at the end of an appointment. Your teeth are all clean and you have a clean surface and you put that varnish on there and it helps, it stays with you and it benefits you for 6 months or so until you go back to the dentist. So they make it sticky so it stays there for a couple hours and then as you brush and floss that sticky goes away, but the fluoride's still doing its job and helping make the enamel stronger so you don't get those cavities.
Like when babies go to eat, why do they start like?
Okay, so babies, puppies, whatever, when their teeth are coming through, you have teeth, when babies are born, there's little buds of teeth under their gums. And as they grow and develop, so do those teeth. And they start to push up through the gums. I don't know if you guys remember when you were younger, even when you lost your baby tooth and you got your permanent tooth, you could see that little white coming through. Well, their teeth, their gums hurt. And they want to, it's just a natural instinct to to want to chew on something to help break through the gum as that tooth comes through. So that's why they're always drooling and crying because their gums ache, and they want to help, it's just a natural instinct to want to make that happen, so they chew on something. In a certain fashion with certain solutions and certain sponges.
You have to like wash it.
Yeah, and then we go under the water and our fingers can't touch the sink, it can't touch any of the knobs. And then afterwards you have to keep your hands up, you can't put them down, or else you have to re-scrub and do it all over again. From there we go into the OR, we use our backs to open the door, we go in, there's a surgical scrub tech, and she hands us a certain towel, and there's a certain way that you're supposed to dry your hands. If not, you go back and you have to re-scrub and re-wash your hands for another 7 minutes. From there, I know, right? Well, because you want to prevent germs and other, pathogens from infecting the patient. So then from there, we're gowned and gloved. They give us our gown in a certain way. We put on gloves in a certain way. And anything is blue is considered sterile, which is super, super clean. Don't mess it up or else you're going to get in trouble. And then we go up to the patient and then, we do the surgery. Thanks. Any questions before our next speaker? Okay, my email's up there, so if you guys want to take it down, ask me any questions later, feel free. And Dr. Pierre is our next speaker. Yeah, what's that?
How do you maintain not getting sick over seeing
patients, how to stay healthy?
Yeah.
I exercise 3 to 5 days a week. I eat my vegetables, a lot of vegetables, and eggs. And I make sure I wash my hands in between every patient. And I also do yoga to kind of mentally be calm.
So you can do anything in the hospital?
As a PA?
Yeah.
So yeah, I have colleagues that are in orthopedic surgery, like bones. I have friends that are in family practice. I have other friends that are in the ER.
No, you as a PA, you can do any procedure?
Oh, okay, so we don't get to do the whole surgery by ourselves, but we get to open, we get to take certain parts of the cancer out, and I get to close the whole breast, for instance. I get to close the whole thing. Close meaning I get to suture it and sew it back up to make it look pretty. All right, Dr. Pia?
Don't put the damage out the nerve. Well, that's what gets damaged in glaucoma. So we actually can take a little piece of the side wall of the eye out, and then we just leave it covered with some tissue here, and then the fluid kind of drains externally. But what it looks like on your eye when you've got that external drainage, it looks like a little bubble, a little cyst on the white part of the eye, kind of up under the lid. We do it up under here so the lid hides it. So the lid can droop a little bit. The bubble can eventually close. The body tries to seal this closed. So, it doesn't even work forever in a lot of patients. It helps, but, we've got techniques we put in medicine to help prevent scar tissue formation so that this hole stays open. And now we're doing a lot of other glaucoma procedures too in addition to that, but that's kind of the one that they had probably talked to you about, was having surgery. That's exactly what we do. We take a piece of the side wall of the eye out, suture some other tissue down over it so fluid can drain externally. Because the internal drainage is all blocked.
So when you do the surgery, you cover the in, right? Or you cover
We lift the lid, we put in something that looks like out of a horror movie. We put in something called a speculum. Now they use a speculum in a different way. We use a little eyelid speculum that just holds the eye open, and then we cut on that white part up there.
Yeah.
Okay, so we do it right on the upper.
It's not outside, you won't see it from the you can't see it. Not on the skin, it doesn't put on
Under the eyelid. Yes, on the eye itself.
So is there any way that can go away?
The pressure?
No, yeah, the pressure can go away.
Well, if you said you had a glaucomatous-cyclitic crisis, that is something that we think that probably a virus or some unknown factor that we're not really sure of causes some inflammation inside the eye. And at the time of that crisis, when your pressure went up to 73, that virus was attacking the drainage pathway in the eye. Caused a little inflammation in the drainage pathway, so for a short period of time, the pressure went sky high because the drain wasn't working. So that can come back again. It's a kind of a rare syndrome, but yeah, it can happen again in the future. So if you ever have eye pain or your eye gets red, then you need to go in and just make sure that it's not that happening again. Good question. Yes.
I have a friend and she's like 90. She said she's got glaucoma and one eye she lost her sight. Is there anything that she can regain that sight? Or?
So unfortunately, the optic nerve is essentially brain tissue. So it's kind of like having a stroke. If you lose some brain tissue, the brain can rebuild a little bit. Guys, so if you have a stroke, the brain can rebuild that tissue a little bit. It can kind of try to reconnect some of those nerves. I mean, these guys know more about that stuff probably than I do, but from our standpoint, once the optic nerve is damaged, it's similar, that you can't get that function back. So fortunately, we've got a lot of peripheral vision, and you can lose about half of the optic nerve's function and really not lose functional vision. So that's the good news, unless you had a stroke that impacted right in the center of the retina for blood flow.
So you're telling me that your friend has to have a stroke to see her?
No, what I'm telling you is glaucoma is like a stroke. So if you lose optic nerve function, it's essentially like having a stroke in that part of your vision. So you can't see and we can't get the vision back. So the whole goal in glaucoma is to keep from losing more vision. So if you sustained a little damage when your pressure went to 73, then your doctors are going to try to keep you from losing more vision. That's why we got to keep the pressure down, so the optic nerve doesn't have more damage.
Did you know this thing in this hotel?
And so with glaucoma, it's kind of like cataract, because cataract is like in the eye.
So cataract is different, but and this is my 30-second lecture on ophthalmology, is simply that there are layers where everything has to be clear and functional. All the light rays have to make it back to the brain. So whether you've got a cloudy cornea, which is up here, it's the clear front covering of the eye, whether that's cloudy, or the lens is cloudy, or the vitreous gel gets cloudy, or the retina has dysfunction, or the optic nerve has dysfunction, all of those pathways have to work well. You could have just one go bad. Your cornea could go bad. You could be born in Saudi Arabia and have a disease called trachoma that's caused by a type of chlamydia, and that it's not the type of chlamydia you're thinking, but it's a type of virus or microbe that causes severe infections in that part of the world and causes scarring of the eyelids and the cornea. And so the rest of the eye can work just fine. But if you've got a cracked windshield, you can't see no matter what you do. I could give you better glasses, brighter headlights. But if you've got a cracked windshield, we've got to fix that cracked windshield. So there are doctors who do corneal transplants, who go in and take out the cornea. Okay? That diseased cornea that's cloudy from trachoma, and you were born in Saudi Arabia, you had this weird disease. We take out that cloudy cornea, and we put a nice clear one from somebody who was an idiot and who was riding a motorcycle and was going 100 miles an hour, and so don't ever get on a motorcycle, I'll tell you that one.
He's 18. So the first 18 years of your life, the pediatricians will take care of you. Now, why do you need pediatrics and why do you need the different docs? There are some docs that we call family medicine doctors who do the whole spectrum. But the body is so complex, so amazing, that it's a little bit easier if we kind of concentrate on different parts and different areas so we can do the best possible for our patients. So, and also, talking to kids is a little different than talking to adults. And there's some folks who just really have so much fun and they love it more when they're dealing with kids. I wasn't one of those people. I got tired of talking to the parents and the child. I just wanted to have one patient. So that's what made me happier, was when I worked with an adult who we could reason and talk and see how we can work together to stay well. And neurosurgery, they do adults. And children too. And children too. Actually, they do adults and children too. We haven't heard from anesthesia.
Donovan Holder, an anesthesiologist and also pain management physician. I think there's a cardiothoracic surgeon in the group. Well, for those of you who aren't aware of anesthesia, what we do, what you're interested in cardiac surgery. Well, for any surgeon to do his job, you need someone like me to do my job. I keep you totally asleep, no movement whatsoever during the operation, and also prevent you from remembering what transpired or what's happening during the operation, which is critical. And more important, we wake you up at the end, okay? There are a lot of pediatricians in this group. I wonder why. Why is everyone interested in pediatrics so much?
Because I like working
with kids. Okay, all right, that's good, that's good. Pediatrics, you'll find, is one of the lower reimbursable physician groups. So that's something to keep in mind also in terms of...
You know what that means? No, I don't think so.
Okay.
He's being very nice about it. when you work as a physician, you get paid by what's called reimbursements. So when you do your work, how much our society and the insurers think they should pay you to do it. And they find with kids, I don't think it's fair, and we don't, and we advocate for people who take care of kids, but the insurance companies don't tend to pay the doctors who take care of kids. They say kids are healthy, they don't need it, and they don't pay as much. So in terms of physician
It's good
salaries,
to do, but it's something to think about in the future also. We
and
want
how
to be,
to advocate for getting better reimbursements for taking care of kids.
At this point, most of you have poured the alcohol into the other test tube. What you should see at this point is a separation. You should have two layers. The bottom part should be very bright, very dark red, while the top should be a little lighter. You'll actually see kind of what looks like bubbles, like strings. That would be the DNA of the strawberry. So what you've done today is you've isolated the strawberry DNA by using a buffer, the soap, and this is due to the fact that soap is both non-polar and non-polar. The reason you can wash your hands and get grime off any dirt is because the non-polar part of it will stick to the grime, while you put your hands in water, which is polar, and it'll get rid of all of it. So we separated our strawberry DNA with the soap, and then the alcohol pulled the DNA away. That's why you have these two layers going on right now. We finished a little bit earlier with this. The last step would be to just collect your DNA. We have little toothpicks right there. So just open your test tube back up and just kind of stick it in and swirl it around, spool it. So you'll get all of the kind of soapy, stringy looking things, the DNA itself. You're going to have it spool onto the test tube and just transfer the toothpick back into your other one. Exactly. You spool it there, so you can put the test tube.
Try again.
It's gonna wait, okay.
Yes, to the empty test tube.
Wait, put in the
Yeah, just like that. It's a little hard to get it out, so I would just stick this toothpick in there. Okay, because of the attractions that are going on. There you go, you're done. So what you should have remaining is in one test tube, should be very clear, while it has the toothpick in the other. You'll have the strawberry solution, and it'll just be like this bright red.
So can we make multiple strawberries with these DNA?
If you could do multiple experiments like this? Oh, like if you could like clone it or anything like that? You could. You would need much more advanced technology, not just toothpicks or test tubes, but it's definitely possible. You can also, we could have done this with any other type of organism. 2 weeks ago, we did one of this back on campus using our cheek cells. We isolated our own DNA and we were able to put it into like a little necklace. And it uses very similar kind of procedure. We use the saline solution in order to separate our cheek cells and put it into a test tube. Then we use an alcohol in order to separate them.
This is a water management structure. This is structures at the south of Lake Okeechobee. You guys know Lake Okeechobee, that big lake, right?
Yeah.
So pretty much in that lake, we actually make sure we capture a lot of rainwater from the north into that lake, and then we use that water to give to farmers and to give to us for drinking water. Those are the main purposes. Also out to like estuaries, like little streams and stuff like that for alligators and all that kind of stuff. So civil engineers make sure that the structure is strong enough to hold water. There's storm surge and stuff like that, so the water, the structure itself has to be able to stand the water pressure and like wind pressure from water. And pretty much structural engineers make sure that you can building structures can withstand pressures also. But I would pretty much go into designing how much water is going to be there, and a structural engineer, for example, will take over how strong that wall needs to be to whatever regulations. Whenever there's a development or something, so if you have a whole entire piece of land, and you want to develop it, you can't just there are rules that you have to follow. So for example, this is the Wellington Mall. You notice here, it's a bunch of parking lot stuff here, and there's a area where there's a lot of water. The rule is that if you are creating a structure, there's going to be an impervious area. So we have a structure here, rain falls, guess what? Water is going to run somewhere. So if you have a little house here and all this was concrete and rain fell, then it would flood this guy over here. So the rule is that you have to contain the unnatural flood that you cause on the property. And also, there are going to be cars driving in this parking lot. So there's going to be grease and stuff like that that's going on in the parking lot. So when that water runs off, it has to kind of get a little treatment, like an environmental treatment, and goes into these lakes. Go ahead, question.
Okay. So how long were you in school before you?
Okay, so the program is a 4-year program, 4 to 5 year program. We can go with skip. Let's see the other.
So if you're
okay, so school and money, because that's what we all like, right? Money, right? We like school too, right? Okay. So first of all, I hated school. I'm strange, guys. So my program is a 4.5 to 5 year program. I also did a master's degree, which took another like 1.5 years. I took about like 7 years, 7.5 years. I kind of like racing motorcycles and doing all that crap too, but that's how long it took me.
So like all the stuff you learned in school and stuff because like you're talking about building roads. What is it that they taught you in the classroom that
I can
really
use?
help you? Yeah.
Okay, that's a very good question. First of all, now that's a very good question. One thing I always say about school for me, it taught me how to learn. It taught me, yeah, it taught me how to learn. I learned about a lot of these things. Sorry, so I learned pretty much everything that I know now. I learned a lot about it, or a good amount of it. But when I started doing, like, when I started like specializing, like I can't tell you a lot about structural engineering. I can't tell you a lot about geotechnical engineering, but I know a lot about it, and I do interact with a lot of other engineers because, like I said, I'll tell an engineer, hey, we're going to hold water 30 feet high, and then he'll come back to me with a lot of questions. I give him a lot of criteria, and he might come back to me like, hey, you know what? I know that you want this, but I can't do that, so I have to adjust stuff. You know, I have to adjust stuff, and we have to abide by law. So school prepares you to kind of learn. And yeah, prepares you to kind of learn the real world, and that's kind of like, to me, in my opinion, it taught me how to learn because this is my